had to be. We're in our rooms now. Our little one cubicle we have, there's 2 of us in here. We're only allowed to be in our bed. We could sit up in a chair, but there's no place to go. You're just sitting. It gets old.
I saw that the staff had a hard time handling the crisis, and there was a lot of breakdowns.
I don't have any family, but I have a family who adopted me. And to not see them, it's bad. And she had COVID, one of them. We almost lost her. If we lost her, I couldn't even go to the funeral. I wouldn't be able to see her.
Yeah.
So thank God she lived.
You cannot push people to their limits. And I think that it was one of the things that we learned in working with the staff. When the pandemic started, our staff was already overworked, like most of the staff at other facilities. But once the pandemic started, they had to do extra duties because they also had to do our vital signs. And so they had to do our vital signs, and they had to turn those in on time. And they also had to do their other duties like cleaning us and feeding us. And so there was an additional rush. And then in addition to that, this management team was cutting the staff so they could make more money. They are not save money, but make more money. And so the staff was extremely cut, short and was pushed. And so it got to the point where the staff was asking the residents to say, please help us, to take care of us, to ask the management to stop pushing us. So it was a situation where the residents had to take care of the staff. And so, the first thing you have to do in a pandemic is make sure that you have people who can take care of the pandemic.
Yeah.
And that's not what happened here.
I noticed that so many of my neighbors, whom I really cared about, went downhill so badly that they had to be put on psychotropic medications. I don't believe, I actually think some of them did worse because I understand lockdown, which they're now questioning. But I feel that some of them have suffered more from some of the side effects of being locked down so tightly than, the coronavirus itself.
Well, they tell me this morning I've lost 7 friends here. I also lost a friend out in the community who certainly makes you cry because it is out there, but it doesn't come home until you hear about it there. But I remember the first one I heard of here, and it broke my heart. And after each one, your heart breaks just a little bit more, a little bit more.
Well, unfortunately, I lost quite a few loved ones, friends, while I've been here and during the crisis.
We lost 4 people this year, good friends of ours. We never even thought that would ever happen to them. And it's very hard to adjust, and your friends are not here anymore. Different patients was coming and tell me who it was, and it was a shock because they were really close friends of mine. I cried.
Yeah, I bet.
I cried
bet.
because
Yeah.
we were all so close.
Because our family and
Mhm.
friends we haven't seen probably in 7 or 8 months. And that's really
Mhm.
hard.
I can't have anybody come see me. I don't get to see my family. I haven't seen my family in months. So I just, I, I just think it just needs to come out.
Yeah.
I mean, it's
It's-
not all roses around the door. It's very difficult for us.
Yes, I feel that I want the vaccination mainly because a few reasons. I've had 24 COVID tests, and lucky enough, they've all been negative.
Mhm.
But in the past 2 weeks, my entire family has tested positive for COVID, and they've been very, very ill. And I almost lost my mother this past week to COVID, and we almost lost her. So that's one of my convincing factors. And I feel this way: either you're going to die from the COVID or you're going to die from the vaccine. So I'd rather die trying.
Mhm.
And I
Okay.
think that the distribution should be for those with underlying issues first.